In the heart of a vastly different London, a band of pioneering women dared to dream of transforming the city. Fueled by their deep faith and unwavering reliance on God, they followed the call of Christ to protect the vulnerable and uphold the inherent dignity of all people. This enduring faith, intertwined with their remarkable legacy, continues to shape the essence of the city, even in the present day. But to truly grasp the magnitude of their impact, we must journey back to 1904. Poverty cast a long shadow over London at this time, with its inhabitants enduring overcrowded, unsanitary conditions. Nowhere were these hardships more palpable than in districts like Bermondsey, where an average of 25 houses relied on a single lavatory and a freshwater tap. Tragically, 1 in 5 children died in their first year. Against this bleak backdrop, Dr. Selina Fox felt a great call from God to respond to the desperate medical and social crisis of her time. All we can do is try to relieve the pressing necessities of the sick and suffering, to ease the burdens of the weary, tired shoulders, and to bring something of the hope and comfort of the gospel of Jesus Christ into dark lives. So the Bermondsey Medical Mission was born, dedicated to offering comprehensive medical and spiritual support to women and children in desperate need. On March the 28th, 1904, staff established their headquarters at number 44 Grange Road. Lacking a suitable medical facility, they wasted no time and constructed a hall on the premises. As word of their compassionate work spread, the demand for their services increased dramatically. Over the next 2 decades, their work touched the lives of hundreds of thousands of patients, offering hope and relief amidst adversity. The First World War, 1914 to 1918, brought formidable challenges. The year 1918 marked the darkest period in the annals of the medical mission. The 4 years of war were fraught with grave anxieties, and challenges seemed insurmountable. In the wake of the devastation caused by the war, the nation found itself grappling with the onslaught of the influenza pandemic of 1919. Dr. Selina Fox and her team faced insurmountable odds but refused to yield, paving the way for a new hospital in 1929. To the service of God and the alleviation of sickness and suffering. The hospitals were staffed entirely by courageous women, tirelessly serving their community. In 1935, Dr. Barbara Morton arrived at the mission and soon became another significant pioneer in the charity's history. The daughter of a Presbyterian minister, Dr. Morton brought with her a resolute faith described as capable of moving mountains. 2 years later, alongside Sister Doris Swain, Dr. Morton embarked on a new endeavour by establishing the Brook Lane Medical Mission in Downham. We believe that God would have us work in Downham in his own time and way. The work to be a work of faith, i.e. no appeals to be made for money. A weekly prayer meeting of interested people essential. The official motto of the Brook Lane Medical Mission encapsulated its dual mission, to preach the gospel and to heal the sick. Despite the chaos and destruction surrounding them during World War II, they found themselves miraculously preserved. Some slight damage to our property occurred frequently, but we were mercifully spared a direct hit, and we are thankful to report that no member of our staff was injured. There was talk of the nationalisation of hospitals threatening the very existence of medical missions. The response was resolute. We made our firm decision not to shut down, so long as the need was present and support was forthcoming. Their unwavering trust in God's faithfulness was met with a remarkable demonstration of divine providence. An annual gift, traditionally generous, doubled in size that year. In 1948, 3 years after the war's end, the nationalisation of the health service brought about the NHS's compulsory acquisition of the Bermondsey Medical Mission Hospital. However, in 1962, the mission repurchased the hospital from the NHS, renaming it the Lena Fox House. a poignant tribute to Dr. Fox, who spent her final days there. Near the end of the war, Dr. Morton identified a fresh challenge: inadequate housing for elderly individuals displaced by the war who now lived alone but couldn't fully care for themselves. In response, Dunoran was established in Bromley, providing nursing care for people suffering from chronic and terminal illnesses, initiating the mission's shift towards residential care. Through the decades, the mission's impact continued to expand, establishing numerous care homes catering to diverse needs. From seaside convalescent homes to specialists in nursing care for long-term conditions and rehab care. In 1991, reflecting its broadening scope of activities, the organisation was renamed Mission Care. This change symbolised a continued commitment to its founding principles of compassionate care and service. Over the years, we've seen many changes take place, from new homes being opened to some being closed or redeveloped to meet the needs of the residents. In 2010, Mission Care expanded its reach beyond borders, supporting initiatives in Wirrali, India. Prior to that, projects had been run in India, Kenya, and Uganda. Every pioneering woman who contributed to building this organisation recognises that their resilience and courage were rooted in their faith in God, attributing the success and legacy to His powerful work. Today, Mission Care oversees the well-being of more than 240 individuals across 5 homes, offering vital nursing and dementia care. Despite facing ongoing challenges, Mission Care remains steadfast in its commitment to serving the vulnerable. Drawing strength from their Heavenly Father's loving provision and protection, they continue to embody God's boundless love and generosity towards those in need. Our hope is that Dr. Fox's enduring legacy will inspire future generations. Driven by a deep love for God and humanity, Mission Care seeks to expand its reach and continue providing compassionate care to an ever-growing number of individuals.
Dr. Selina Fox saw clearly and built well, but God Himself was her strength, and will be for those who follow.